Hello, my name is Grace Peng, and I created a literature review that analyzed the complexities of major depressive disorder. So major depressive disorder, also known as MDD, affects 3.8% of the global population, making it one of the most common mental illnesses worldwide. And so currently, empirical methods of prescribing medication are limited and impersonalized, leading to increased risk of patients having negative to no response to medication. This leads to them having to switch medication, which can cause impairments in their health, such as withdrawal symptoms or drug overlap. Therefore, it is crucial to develop methods of personalizing treatment and creating more precise diagnoses in order to better cater to patients' needs. And so in my review, I analyzed three main topics of interest, one of which was risk factors, which are associated with the likelihood of disease, and these include physical health, genetics, environment, and personality traits. Next of which are biomarkers, which can help indicate the state of the patient, and these include structural and functional alterations in the brain. Last of which are treatments, and I explored the current extent of how treatments affect MDD patients. And so with these interests are a few main highlights. So first of which are the interactions between genetics and environment. And so genetics are the predisposition to developing depression. And so genetics can help influence your response to environmental stimuli. And so even if you do have a predisposition to depression, that does not mean you have it. That just means you're more vulnerable to having it. Next, with somatic symptoms, pain is usually seen as a separate entity from depression. However, pain can also be a symptom alongside emotional symptoms. Next are types of treatments. So there are a few types of treatments. One group is conventional treatments. And so these conventional treatments usually include medications and antidepressants. Complementary treatments are another group of treatments where these include cognitive behavioral therapy, ECT, that can help boost the effectiveness of conventional treatments. And so next are the exploration of target genes and proteins. And so alongside the serotonin transporter, which has been commonly researched as a factor in depression, there are also other genes and proteins such as MHD1 and BDNF that could be used as targets in order to help treat patients or to indicate the state of patients. Lastly, are structural and functional alterations in the brain in MDD patients compared to healthy individuals. So this includes volumetric changes in the limbic system, more notably the hippocampus and amygdala, as well as changes in neuroplasticity. And so based off these highlights are a few recommendations. So first of which are the use of pharmacological and non-pharmacological treatments in conjunction. So with this, non-pharmacological treatments can help boost the effectiveness of conventional treatments, as well as tackle those holistic factors that can help improve the lifestyle of MDD patients. Next, we can use target genes and proteins, and also the brain alterations to use as clinical markers to help indicate the state of the patient, as well as hopefully prescribe treatment. Next, we can track somatic symptoms with emotional symptoms to possibly help describe the state of the patient during remission and being able to see what the patient needs. Lastly is the use of biological factors in consideration when prescribing treatment, because factors like age and sex can influence how a patient responds to treatments. And so being able to factor that in, as well as provide an environment where people can heal, is very essential to helping MDD patients. And so in summary, it is important to create more precise methods to diagnose MDD, and this can come with creating subtypes of MDD that is associated with certain characteristics. With this, we can create more personalized methods to prescribe treatment. And so in order to achieve this, first, we have to possibly have more research into these target genes and proteins to use as clinical markers. And so we can identify if there is a causal relationship between these markers and the state of the patient in order to be able to apply these to clinical applications, being able to use these markers in clinics to be able to assess the state of the patient and possibly creating more precise diagnoses and personalized treatments. Thank you for listening.